Good evening, all participants of the webinar. Thank you for attending this webinar. I'm very happy to share this presentation today in this second seminar of serial openIMIS webinar. I would like to share a little bit about the situation of health insurance in Indonesia. And then later on, we could also discuss about why on implementing the openIMIS in Indonesia, we could not start directly on the real situation, but we choose from the academic setting or point of view. So before continuing my presentation, I would like to introduce my name. I would like to introduce myself. My name is Anis Fuad. I'm working as a researcher and also teachers at the University of Gadjah Mada in the Faculty of Medicine and Public Health and Nursing. So before I start more detail about the social health insurance situation in Indonesia, I would like to quote the 1945 Constitution of the Republic Indonesia, which state that all citizens, including the poor and vulnerable, are entitled to proper health care and delivered by qualified health care personnel. This was stated in the national constitution, but in reality, we know that Indonesia was independence in 1945, but then the discussion regarding the social health insurance, I think it was started 50 years later. And then by 2005, we have the social security law. But after the law, the process has been, we could say, it is not easy to start on how to implement directly on the transforming the organization and also the direct services to the populations. And then finally, in 2014, we implement the law by transforming the former health insurance agency that formerly only cover for civil servants, but right now it became the single payer or called the BPJS or the Social Healthcare Agency on 2014. And then from 2014, this organization was aimed to achieve universal health coverage by this year, 2019. On January, this organization already has a member about 218 million of population, or already 82% of the population. But there was also a big discussion, some struggle because there are many stakeholders involved. And between 2012 until right now, 2019, there were several negotiations, brainstorming from different parties, including what are the content of the benefit package, the premium setting, facing on achieving universal health coverage, several steps and activities needed, and also the preparation to develop the organization or the BPJS Kesehatan. So I think it is also a good resources for many countries to learn about the Indonesian situation on implementing social health insurance. And then right now, since 2014, we have already this BPJS Kesehatan or the Social Healthcare Security Agency. This BPJS Kesehatan actually has the mandate to serve the members and also working together with healthcare providers. In terms of the governance, BPJS Kesehatan are actually regulated by Ministry of Health that setting several policies regarding the payment rates, schedule, and then setting contribution rates and also the benefit package. BPJS Kesehatan also supervised and monitored by Social Security Council and also supervised and regularly audited by Financial Audit Bureau, Anti-Corruption Committee, and also Public Accountant Office. Members of the BPJS Kesehatan has the right to utilize healthcare services provided by healthcare providers, and healthcare providers could submit claim for every services that has been offered to the members, and then BPJS Kesehatan later on verify the claim and pay to the healthcare providers for any claim that has been submitted. Members could also has access for administrative services from BPJS Kesehatan and also pay the contribution to the BPJS Kesehatan. So in terms of data exchange in the Indonesian Social Health Insurance, all members with national ID could access to the healthcare services either on primary care or secondary care, and we have also this kind of referral system, and there were some data exchange that has been occurred from members to the healthcare providers. So for example, we need to ensure the eligibility of the members, whether we are still active members due to we are still active to pay the premium, and also in terms of the data in the healthcare providers also need to submit the data to the district health offices, provincial health offices, and also the Ministry of Health through the health information system channels. And also there were some data exchange from BPJS Kesehatan to the Ministry of Health, and also some other agencies, including Ministry of Home Affairs and also Central Statistic Bureau. There is also right now some activities to use the data that has been collected by BPJS Kesehatan, including the sample of administrative data, about 1.5% of the population that could be used by research institutes for research and also for conducting any studies. So right now, in terms of the ecosystem in the health insurance, BPJS Kesehatan actually has a strong IT system, data center that every day maintain about 700 transaction from primary health centers, and then there are also 2,400 hospital that regularly submit claim to the BPJS Kesehatan, and also there are also about 4 million members of the BPJS Kesehatan that already downloaded the apps in which they could access some data or historical data from the apps. It is something that has never been available before in Indonesian healthcare system, where people could access easily on healthcare historical visits in the healthcare providers. Not only for healthcare services, the IT system of BPJS Kesehatan allow a connection from about 682 payment channels, including bank or any payment channels, convenience stores, where members of BPJS Kesehatan could pay the premium contribution through this payment channel. As we mentioned before, there are 27,000 providers, including 23,000 primary healthcare and about 3,000 secondary care, including hospitals. And also, BPJS Kesehatan also have several initiatives on application programming interface that allow several channels working together for electronic data exchange. After the coming of BPJS Kesehatan in 2014, there was also evolution on health record management in primary care. Mostly previously, many healthcare providers were working with paper to write on the medical record. But right now with PCARE, a cloud computing-based information system provided by BPJS Kesehatan, all primary health center should also fill the data into this cloud-based system. And later on, this data could also be accessible by members through these apps, or we call this mobile JKN. In this cloud-based system, actually, some data regarding the subjective, objective assessment and plan could also be entered into the systems, even though there are still many problem occurs related to the completeness and also the accuracy of the data in the electronic system. And this is also some innovation that occur right now after BPJS coming, where people could access also through the mobile apps the history of the visit into healthcare providers, and also some data related to the diagnosis, and also some drugs that also has been given to the patient. But however, there are also some issues related to the bridging system and also the interoperability between BPJS Kesehatan with other information system in the primary care. Because in the primary health centers, usually there are also other information system available. For example, from the Ministry of Health, there are also information system for certain disease program like HIV, TB, and also malaria, for example, which is right now are not yet interoperable with the information system from the BPJS Kesehatan. And I think this is just an example on on some of the on the apps in of mobile JKN, where members of BPJS could also access their profile. They could change also the membership to the primary healthcare. They could also show the electronic card when they come to the health facilities. They could also complain for services in the healthcare providers. They could also access for some visit into the hospital. They could also pay the premium and also access some preventive data like a screening. So this is just an example. If we have fill the screening information, there was also some information related to the result of the screening information that has been filled by the users. So after the coming of BPJS Kesehatan as the main operator in the social health insurance, so there is also some question whether this innovation is categorized disruptive or undisruptive because, for example, the paper-based management of medical record that formerly occurred in primary health centers after the coming of health insurance, right now many becoming um, more digital situation. They already use information system, but still some also maintaining the paper base because currently we don't have strong regulation and also firm regulation the position of electronic medical record. And also formerly people do not have access to health record, but right now with mobile JKN we could also access the history of our data in the hospital. So in terms of the digital transformation in the social health insurance, I think when I try to compile several uh, innovation that has been occurred after the coming of the BPJS Kesehatan, at least there are several I think milestone that we thought it is important to note. First, I think, for example, related to the administrative eligibility. The coming of the digital innovation in Indonesian social health insurance right now has changed from formerly more on paper-based copies of documents and then referral letters. But right now, after the digital innovation in the social health insurance, we have also the bridging system or interoperability, so that patient, when they only have their ID, they could also access the health facilities without the administrative document should be uh, brought by the patient. And also between healthcare providers, they could also transfer data from one healthcare provider to other due to the interoperability. And then in terms of the availability of information system in primary care, before social health insurance, there was about only 40% of the puskesmas or primary health care that already equipped with the health information system. But right now, nearly all puskesmas utilize PCARE, the cloud-based system, but mostly are still hybrid. So they are still maintaining the paper-based, but the data on electronic system are already equipped, are already entered by the staff. Some report mentioned that from all around Indonesia, still 11% of the primary health centers could not access the PCARE. This is mostly in the remote and in the rural area. And people right now could also access the historical data that was only available after the coming of the apps. Formerly, we don't have access to the health visit data. After the coming of the health insurance, some initiative on telemedicine was also conducted, mostly by the Ministry of Health. Interestingly, in the latest regulation on the Indonesian social health insurance, it is also mentioned that BPJS Kesehatan is allowed to implement telemedicine, especially in area or in a district where there was a limited number of healthcare personnel or health facilities. In hospital, we already implemented DRG, diagnostic related group, using Indonesian case-based group. formerly this DRG was only implemented in the Jamkesmas scheme or only for poor people, but right now this DRG implemented for all type of members. And then secondary data for research. Formerly, we don't have data or administrative data that is coming for any transaction in health facilities that are available for people to do research. But since January 2019, BPJS Kesehatan has released the, I think it is less than 2%, 1.5% sample of the population are already available for research institutes to conduct research. So I think this is several digital transformation that has been occurred in the Indonesian social health insurance. But anyhow, there are several challenges in Indonesia. For example, with the big geographical area, there are still some inequity related to the health development. Mostly district with a better health situation are in Java, but then many in outer of Java are not in a good condition. And also related to the digital access, mostly the people have easily internet access 4G in Java Island, but in outer of Java, mostly in the eastern part of Indonesia, there are also some difficulties to access internet and also some ICT services. Based on the situation or the macro illustration on the social health insurance from the perspective of information technologies, and then the question is how about to implement openIMIS? Since the first meeting of Indonesian team with openIMIS, we say that openIMIS is a very, I think, is a promising tool for learning the social health insurance, for learning managed care, for example. But uh, to make this openIMIS as part of the real implementation, I think for Indonesian setting is still far away to go. But then we consider that there is opportunity for openIMIS to be implemented in Indonesia. But the question is where and how. So after we learn from the discussion and also several presentation from openIMIS colleague, this web-based application that allow some generic use case of the social health insurance and also have been implemented in a few countries like Nepal, Tanzania, or others. We consider that these use cases are very important, especially for students, in which me with other colleague in Gajah Mada University is trying to adopt this openIMIS and trying to understand the system description, some functionalities that available in openIMIS, and then based on the situation in Indonesian social health insurance, we will propose several scenarios that allow students to learn from openIMIS. But there are also some questions regarding how to make the Indonesian use cases, for example, on claim, on registering the members, on registering the healthcare providers, for example, are easily adapted into the openIMIS web-based system. So this is also our question also to our colleague in openIMIS regarding on how to allow some countries, for example Indonesia, with the facilities to, for example, to import some data related to the existing data on healthcare providers, so that this data could be easily enter into the system. And then some rule regarding claim, for example, we have Indonesian DRG system. This one that I thought is important for the upcoming project in Indonesia. And then we would like also to invite our student as well to criticize the result on tailoring the openIMIS with Indonesian healthcare situation. I think the closing of this presentation, this short presentation, I'm closing with first Indonesian journey on social health insurance has been followed with a rapid and massive scale on digital innovation to support the reform. And then in terms of learning, especially on openIMIS, we consider that openIMIS has opportunity to be adapted in academic setting, especially in Gajah Mada as learning resources. But then we need also to discuss more detail with our colleague in openIMIS regarding the standard and interoperability, so that we could easily transfer the data or the current setting in Indonesian healthcare systems to be adapted and customized in the openIMIS for the academic ecosystem. I think that is my short presentation. I'm looking forward for any discussion. If we could have questions, I think I'm very happy to share and discuss and probably describe more detail with you. Thank you, Cha, and I let the mic open to you.
Yes,
Thank
thank you
you.
for that presentation, Dr. Anis. We're now opening the question and answer. So if you have questions or any part of the webinar that you would like to clarify, please let us know through the questions box. Now we have a question from Mr. Siddharth from Swiss TPH. Could you please explain again how a patient is identified at the point of care in the health facility?
So that in Indonesia we have a national ID. This national ID is managed by the Ministry of Home Affairs. In this national ID, 206 in the all the adult have this national ID. But then if they bring the children, if the parents show the national ID and then mention the name of the kids, the system with electronic system, either in primary healthcare and also in the hospital, especially hospital that are in partnership with the BPJS Kesehatan, they could access the population database from the Ministry of Home Affairs. So based on this electronic access, people could be administered and registered to the hospital. Indeed, in our national ID, there is also biometric data, but right now we don't have this kind of biometric validation in the hospitals. So mostly the validation is based on the uh, photograph image in the national ID card. I think that is the way to identify the patient in the healthcare provider. Thank you, Cha.
Yes, thank
Is
you,
it
Pak
clear?
Anis. We have another question.
Yeah.
It's from Miss Victoria. Hi, Anis. Can you compare the current BPJS IT system and openIMIS functionalities?
Oh, yes. Thank you very much. With regard to the comparison of a BBGS system and openIMIS, I think from the openIMIS, it is still we in the generic version there are some functionalities related to the registration of the healthcare providers, which is also similar function with the BPJS system to register the healthcare facilities. But the difference are on the detail. For example, detail of each type of hospitals, etc. There are some different detail on the on this aspect. But the function on healthcare provider registration, BPJS have this kind of function. openIMIS also have this kind of function. The second component related to the registration of the members. BPJS have this kind of registration of the members. openIMIS also have this kind of registration of the members as well. The difference are also on the detail, also the mechanism to register. In Indonesian BPJS system, people could register from many channels, including they come to the office. They could also register from uh, uh, call centers. They could also register from uh, mobile unit, for example. But the detail here are very different with openIMIS. But the main function on member registration, I think, is similar. The third one related to the healthcare provider and single payer interaction. The function related to the submitting claim, I think they have this kind of functions, but the different are on the DRG calculations and also the detail of the data in the DRG calculations. I have not yet checked the function on fraud detection in openIMIS and also in openIMIS, but in BPJS system we have also this kind of fraud detection mechanism. openIMIS, according to the presentation they mentioned they have, but we don't have yet detailed comparison and also detail side by side, variable by variable different comparison. Thank you for the question.
Yes, thank you, Pak Anis. Our next question is from Dr. Sugma. What are the advantages of openIMIS, especially for insurance company?
Thank you, Dr. Skuma. I think we need this related to the advantages. I think we need to hear more detail, I think, from our colleague in Nepal or Tanzania who already implement this system. I think the most important issue is if openIMIS has the functionalities that meet the needs and demand and also meets the and also comply with the workflow of the insurance system. If the insurance system do not have this kind of technologies, I think there are opportunities to use this kind of technologies. But in terms of the real benefit, because each insurance system has their own systems workflow, this thing that need to be examined clearly and detailed. For the Indonesian health insurance, I don't think openIMIS could provide any advantages for BPJS because it is a very far different. But for my perspective as teacher and researchers, I still consider that openIMIS has opportunities, especially for the academic setting, in the laboratory setting, in the universities, where a student has opportunity to compare what has been learned from the theoretical perspective and how to implement and more practical implementation on on utilizing openIMIS in the lab. I think there are opportunities. But for insurance, we need to know more detail about what kind of insurance organizations, what are functionalities, and also workflow that has been implemented, and then whether they have already information system or not. And then there will be some follow-up question related to the advantages. I think it is part on how to identify, to conduct such kind of requirement analysis before implementation. Thank you, Pak Sukma.
Yes, our next question is from Mr. Siddharth. Could you elaborate more on how you intend to include openIMIS and social health insurance courses?
Thank you very much for this question. Um, yes, in Gajah Mada University, we have a graduate program on public health. In this graduate program, we have concentration or majoring on health insurance. In this majoring on health insurance, there are several courses, and among the course that we consider this is the most appropriate one to adopt openIMIS as part of the learning is the course on managed care. In the course of managed care, we have already identified several learning objectives and also a face-to-face meeting that we consider a student could learn and also implement the theory on managed care through openIMIS. So we have identified already for face-to-face meeting to be supported with openIMIS, and several scenarios will be developed. So right now, our process right now is to translate from the existing learning objectives with 4 scenarios uh, to be implemented in the course. So, for example, in terms of the, for example, in the managed care on healthcare provider registration and also healthcare provider collaboration between a healthcare provider collaboration with health insurance. So we will have these scenarios and also some exercise to be implemented, and then students are requested to have this kind of exercise in the laboratory or after the class. So there are about 4 practical learning on openIMIS, but because this is on the first trial, we need also to have we need also to request the student to give feedback on the practical session that will be conducted later on. So based on the feedback from the students, I think next year we will have more detailed courses using openIMIS, and hopefully next year if we have good and also continuing collaboration with openIMIS, hopefully we could have a more Indonesian setting scenarios. Right now, I think it is still on the generic part scenarios, but next year we are expecting more Indonesian setting that allows students to learn more detail and more customized to Indonesian setting in MPH program. Thank you for the question.
All right, this next one is from Dr. Newman. Dr. Anis, this is exciting work. Hopefully, this will spark more research in healthcare in Indonesia. So the questions are, how do the healthcare provider consolidate their data when they have multiple systems in place? And is there a plan to roll out the system countrywide?
Thank you. It's a good question actually related to the current situation in Indonesia that mostly healthcare provider in puskesmas we still have problem on multiple systems that are not interoperable each other. So I'm just thinking first related to the combining multiple data sources. Uh, so far, I think it is yeah, it is cumbersome and takes time to combine multiple data sources into single data that I think could be used for many purposes. Indonesia have a policy on one data, for example, but it is, I think it should be strengthened with more policy and regulation and enforcement on interoperability and standard. If we don't have this kind of standard and interoperability policy, I think it is still far to go to achieve this one health data policy in place. So I think for the practical recommendation, I think it is very important for the Ministry of Health to implement the regulation and on standard and interoperability. On the other hand, I think the initiative from the BPJS Kesehatan providing this 2% sample of the administrative data is a very important step to open the data from healthcare providers for many researchers in the country. I think it is also right now, I think by 2019 it also a good momentum for many research institutes in Indonesia to use this kind of data for research. And on the same time, parallelly, Ministry of Health should work also together with BPJS Kesehatan to have this kind of policy and also strong establishment on interoperability between multiple information system, which is right now it is still not yeah in talk each other. Thank you, Pak Nyoman.
Yes, thank you, Pak Anis. I think that's the last question from our participants. Again, thank you for sharing your time and expertise with the network, as well as to our participants who actively joined this webinar.
Okay, thank you, Cha. Thank you, all participants. Thank you for your questions. See you next time.